Howdy y'all, in today's video we're going to discuss inflammation. I'm going to tell you exactly why you need to worry about inflammation and what is going on. We'll also discuss what can be the consequences of long-term inflammation, and at the very end of the video I'm going to give you my top 10 foods I recommend to decrease inflammation in your body to hopefully reverse the process and get your body back on track. So if you're worried about inflammation, what is going on with all the irritation going on entering your body, this video is for you guys. Let's talk about this. Howdy, I'm Dr. Islam. I'm a board certified gastroenterologist trained at the Mayo Clinic over 10 years of treating thousands of patients with all sorts of inflammatory issues. We would love to be a partner in your journey. Consider going to loveitgastro.com for more information. So what exactly is inflammation? It's kind of a very nebulous term. Some people throw this out there and don't really understand what inflammation means. Normally your body is in this steady state where you have this balance between positivity and negativity. And so your body loves to be in this normal state. And so I'll give an example, pH, for example, acidity. So anytime there's a little bit more acidity in your body or enters your body will respond to that and make it more basic. So you can always have this balance that's there. And your body loves balance because anytime anything is out of whack in that sense, your body will do something to reverse that. Another example is fever. So when you have an infection, this is an irritation going on inside your body. And so because of the irritation, your body will respond by producing a fever to decrease that irritation to maintain the balance that's there. When you have inflammation, what happens in that process is that balance actually becomes out of whack. You actually have more pro-inflammatory components going on into your body that your body has a difficulty time to respond to. It gets overwhelmed by all the inflammation going on and all the irritation that enters your body. So there are a lot of reasons why you can have inflammation. Let's use, for example, joint pain. Yeah, as we get older, including myself, we're doing more and more wear and tear on our bodies. Our joints hurt, our back hurts, our muscles hurt. That produces an inflammatory response. You feel that as pain. And so one way to decrease that pain is to use anti-inflammatory medications, Aleve, naproxen, Advil, Motrin, that actually will physiologically decrease the amount of inflammation going on inside your body. That's a response of the inflammatory process going on because the joint issues that you have, the bones, the ligaments not working correctly, the bone-on-bone damage that you have as we get older through wear and tear. Your body will also have inflammation for other different reasons as well. Let's use autoimmunity. If you have an autoimmune disease, your body's actually attacking itself to cause the inflammation to occur. Now, what triggers that can be multifactorial, whether it's genetics, food, or the environment, but autoimmune diseases are the basis of where inflammation comes from when you have an inflammatory process. So for example, lupus, Crohn's disease, ulcerative colitis, Sjogren's disease, rheumatoid arthritis. This is an inflammatory process going on that's triggered in which you produce a lot of inflammation going on that can manifest in a lot of different ways. So for example, in rheumatoid arthritis, you have joint pain. In Crohn's disease and ulcerative colitis, you have diarrhea, you have abdominal pain, you have bleeding, and you have weight loss as well. And so because of that, you have to have an anti-inflammatory response to that, which is why we typically use medications to decrease the inflammation going on inside your body. Now, a lot of us don't have to worry about this because a lot of us don't suffer from these autoimmune diseases, but we do have normal inflammation going on in the course of our life. Our body's always on the lookout for some of these inflammatory processes going on that can irritate us and cause us a lot of damage. Now, what's happened in the modern world is that the amount of inflammatory process going on has been tripled or quadrupled by a lot of different reasons. There's more toxins in the environment. There's more toxins that we ingest. The foods that we eat are not the same type of foods that we had maybe 30 or 40 years ago. There are more things added to the foods, and our environment is responding with multiple different reasons to cause the inflammatory process to occur. In fact, this is one of the reasons I believe that we're seeing a rise in things like colon cancer in younger individuals. It's also the reason why I am seeing a rise in a lot of other diseases that we did not see in younger individuals. And the root cause of why we're having the inflammation really comes down to what we are eating, because the vast majority of the toxins that are entering our body is from the foods that we eat. Just think about it. We eat at least 3 times a day, and these are foods that we just ingest in our body. This will bypass all the other barriers that you typically have to protect yourself. So for example, your skin. Your skin is a very protective barrier against the UV light. When you're ingesting food, this is bypassing things like that. And it gets easily absorbed inside the gut, in the small intestine, and in the colon as well. And in your GI tract, you have this constant battle that's occurring between the pro-inflammatory processes and the anti-inflammatory processes as well. Now, what happens is that as we've changed our food eating habits in terms of how we eat and what we put in our food and how we actually preserve our food, we're actually increasing the amount of inflammation in our body tremendously. This is almost 10 times the amount of inflammation that we typically had maybe 30 or 40 years ago. It's in the types of foods that we're eating now, a lot more complex carbohydrates, a lot more sugars, a lot more bad fats, a lot more bad proteins. It's the way our foods are preserved in terms of the type of chemicals that we're using to preserve our foods, the types of ways that we're actually prolonging the shelf life of our food, and the types of ways that we are sweetening our foods as well, and just the overall combination of all that in terms of what we are eating. In fact, when you look at just the overall environment, just when you look outside, you can see that people are just not healthy. They don't look healthy, they're obese, they have other medical problems. We have diabetes in younger individuals, we have hypertension in kids. It's crazy. This would have been something that would have been completely unknown in the medical field. And so the vast majority of the reason why we're having inflammation really comes down to food. Now, for the everyday people, this may not be a problem, but what's happening in your body is that you're having this process, this constant battle, and your body is losing because of the amount of the inflammatory process going on inside your GI tract. Your gut microbiome is the literal ground zero where all the irritation is going. And in that gut microbiome, you have this battle going on between the good bacteria, the good fungi, the good viruses, and the bad bacteria, the bad fungi, and the bad viruses. In the vast majority of people, we are losing this battle. This is why you're feeling fatigued, why you're having abnormal bowel habits, why you're feeling like you're having bad acne, why you're just not feeling like yourself. You don't feel healthy. And it really comes down to what we're eating, because this is the vast majority of where all the irritation is occurring, the vast source of why you're having all the issues that you're having. So what can we do about this? Now, there are a lot of things we can do, but it really comes down to what we eat. And what we want to try and do is increase the amount of anti-inflammatory foods as much as we can, because this will form the basis of what we can do to change what's going on from the inside out. And by doing that, we can hopefully resolve a lot of the issues that a lot of my patients and maybe you may be suffering from, whether it is poor sex drive, whether it is poor energy, whether it is abnormal bowel habits fluctuating from constipation, diarrhea, bloating, heartburn, reflux, nausea, vomiting, joint pain, skin issues. We're seeing a lot of this being manifested inside the GI tract. So, what are the foods that I recommend as a GI doctor for us to switch to so we could actually have more of an anti-inflammatory effect that's a natural approach that you may not have to use external medications to change what's going on? Here are my top 10 foods, and by doing these and incorporating these foods, you're able to change your gut naturally, but also hopefully affect what is going on from the inside out and change your gut microbiome. So number one are leafy greens. Leafy green foods are literally nature's superpower to change what's going on from the inside out. They have everything your body needs to actually have the anti-inflammatory effect that you need. These include things like spinach, kale. These are actually packed with all the vitamins, minerals, fiber, and antioxidants that is naturally occurring in the environment. And by incorporating more of these foods, you're actually giving your body a chance to change what's going on from the inside out. Now, my recommendation is find one particular leafy greens that you enjoy and use this as a basis to at least incorporate once a day. So for me, for example, I love broccoli, I love spinach. These are foods I really do enjoy, and so I make it a habit for me to have at least one big helping of either broccoli or spinach every single dinner. And this gives me at least one basis to incorporate these leafy greens, because this will give me the natural immunity that I can do to hopefully decrease the inflammation that's occurring inside the environment, also inside my GI tract as well. Number two, berries. Berries are fantastic. Now I want you to think about blueberries, strawberries, blackberries, raspberries. These small little fruits actually pack such a big punch when it comes to the effect of your GI tract. More and more studies are suggesting that berries actually are nature's key to change what is going on. And so I also just try to incorporate this into my diet. I have a handful of blackberries every single day. And I found that for me, this gives me the sweetness that I enjoy, but also can change what's going on. There are actually more and more studies suggesting that these types of berries can actually change your cognitive health as well, how your brain works, and your risk for dementia. So I'm getting older, and I want to do what I can to make sure I can live longer, but also live the healthiest that I can as I get older. So incorporate berries into your diet every single day. So on the protein standpoint, I want you to think about fish as the basis for protein. For some reason in society, especially here in the Western world, we have emphasized protein so much, which is good, but I think the emphasis has been wrong on the types of protein that we should try to incorporate. Now, people will tell you, you'll have beef, have chicken, and that may be okay in moderation, but fish by far ends up being the best part of the protein that you can have into your life. It's part of the what's called the Mediterranean diet, which out of all the diets that are out there, this is the only, or one of the very few diets that's been shown in clinical trials to help out with everything in your body, your brain health, your heart health, and your gut health. And what's important about the Mediterranean diet is the emphasis on fish. So fatty fish like salmon, sardines, mackerel, these have the fats that you need. They're healthy fats. They also have the proteins that you need as well to give you strong bones and also allow you to live better and live longer. In fact, when you look at the studies of those individuals that actually die sooner, that have frailty, these individuals actually are known to have what's called sarcopenia. They don't have a lot of muscle. The muscle mass is gone. I see this also in my own clinic where I have older individuals who have liver disease, and the biggest sign that I can see just on physical exam they have liver disease is that they don't have any muscle. They have muscle wasting, and that's a predictor for early mortality or early death. So the more you can incorporate protein into your diet, especially healthy protein, this is the way you're going to change what's going on from the inside out. Now, the studies have suggested aim for at least 2 servings per week, and that's what I would do for myself as well. Number 4, nuts. Nuts are great. I love nuts. I'm a big fan of nuts. Walnuts, peanuts, almonds, these are great snacks to take on the go. They have healthy fats that you need to help change kind of the cholesterol and your triglycerides. They have a lot of fiber. They're anti-inflammatory, and they're a great snack. This is much better than any other snacks you may be having, such as chips or whatever else people are doing, Twinkies, Snickers, whatever. Aim for just having a handful of nuts, and that's it. You can incorporate this. It's filling, it's great, and it's really good for your GI tract. I try to incorporate at least 1 handful of nuts every single day in my diet to give me the energy, but also give me the healthy fats so I can change my cholesterol and allow me to have a healthier life. Number 5, turmeric, the golden spice. I love turmeric, and I cannot tell you how many studies have shown turmeric to be an incredible anti-inflammatory herb. It is great. It's recommended for ulcerative colitis. It's recommended for rheumatoid arthritis. It's recommended for joint issues. Literally, it is one of the best herbs you can add into your diet. Now, it may be hard for people to incorporate turmeric into their food. So what I do, I actually add turmeric into my coffee. Yes, let's see. Just a handful of turmeric is all you need. And this is a great way to spice up that coffee to give you the spice that you need without having to incorporate turmeric in other ways. I have found that the best way to take turmeric is not with a pill, but with powder, or maybe it's a herb, and just sprinkle it into your coffee, mix it in, and make your coffee better. And I can tell you the benefit has been incredible, not only for my own health, but for all my patients who are having maybe joint issues or who suffer from ulcerative colitis or Crohn's disease. Number 6, garlic and onions. So this is also an incredible anti-inflammatory food that you can incorporate into your diet. I mix this up whenever I'm having my food. I add in some garlic, add some onions. It's great. I have to give you a big caveat though when it comes to garlic and onions. Garlic and onions are considered high FODMAP. So if you have issues with IBS, whether it's bloating, distension, nausea, and you're having a lot of issues with that, one of the recommendations that we recommend in the GI world is to get on a low FODMAP diet. So if you are on this diet and you're having diarrhea or having bloating, don't incorporate garlic and onions. It's not gonna be good for you. But if you've not been diagnosed with IBS, or if you don't have bloating or diarrhea, incorporate garlic and onions into your diet. It's great. It'll spice up your food. It's a great anti-inflammatory component into your diet. Number 7, extra virgin olive oil. Now you will see a lot of stuff on social media about seed oils, animal oils, the benefits and the risks and all this stuff. I'll tell you just kind of briefly, the evidence is very difficult for us to really understand what that evidence is. However, it is very clear that extra virgin olive oil is great for you. And so out of all the oils you can incorporate into your diet to cook your foods, this is the type of oil I want you to use. Don't use canola oil. Don't use any other oil. Extra virgin olive oil is probably the best thing you can do to give you the type of cooking that you need to saute your food, but also to do it in a safe manner. It is the cornerstone for the Mediterranean diet. I sprinkle it on salads that I have. You can saute it, you can drizzle it, just do whatever, but this is the type of dressing I want you to use if you're gonna try to saute your food or at least maybe spice up your salad as well. Number 8, avocados. I love avocados. It's also part of the Mediterranean diet. They're big, they're creamy, I can smear it on things, and it's got healthy fats as well. It's got monosaturated fats and carotenoids, can also help out with inflammation. Number 9, you'll be surprised, dark chocolate. Yes, dark chocolate is a great snack, and it's a great way to incorporate some sweet things in your diet. See, I'm not so bad. I'm not just this blowhard, be like, you can't have good food, you can't have fun. Dark chocolate is one of those foods that have been shown in multiple trials to help out when it comes to inflammation, cholesterol, and it's good for you, and it tastes good as well. The darker the chocolate, the better it is for you. So I enjoy my dark chocolate every single night before I go to bed. It's a little sweet thing. Oh, it's so good. So I want you to enjoy this. You can incorporate this. It's great. You know what? I'll tell you a little secret here. I actually have some berries with my dark chocolate. I freeze it up, and so I have something cold, something sweet, and something chocolatey at night. Oh, it's a great combination. I love it. And keep in mind, I'm gonna recommend at least 70% cocoa as how I want your dark chocolate to be. Then lastly, fantastic, green tea. Green tea is great. It's full of carotenoids, which is a type of antioxidant that's been shown to reduce inflammation. It's also been shown to reduce the risk of dementia as well. And so I love coffee, but on the occasional time, I'll also add in a green tea. It's great for you. I typically do matcha green tea. I don't add anything else to it. It's good caffeine boost, but also it's been shown to help decrease inflammation and decrease your risk for dementia. So guys, there you have it. These are the 10 foods that I recommend to decrease inflammation, to change what's going on naturally from the inside out. Is if you're worried about inflammation, which you should be, if you're having joint issues, brain issues, if you don't feel good in your gut, these are things that I recommend to try to change the process naturally from the inside out. And by doing this, I think you can win the battle, you can defeat inflammation, and hopefully get you feeling better as well. So have you tried these foods? Have they worked for you? What recommendation you have? I'd love to hear what you guys have to say. Comment down below. I'll read all my comments, and I appreciate you guys watching this video. If you want to learn more information on what you can do to change your gut naturally, come see us at lovegastro.com. We do consultations via in-person or in telemedicine, and don't forget to subscribe to my channel and my newsletter as well.